Some other headlines that we're watching at this hour. There's a good chance that you or someone you know is sick. Severe cases of COVID and the flu are on the rise. The CDC says the worst is yet to come. Here's what's happening specifically in California. These charts kind of tell you the story. On the left, the number of people in the hospital because of COVID, a steady rise since November. On the right side of your screen, look at that rise. People in the hospital because of the flu, a sharp increase in the past few weeks. No coincidence, this comes right after the holiday season. According to the CDC, California is actually seeing some of the highest levels of flu activity in the country. Doctors are bracing for what could be one of the most severe flu seasons in decades. Tonight, the doctor is in. Dr. Peter Chin Hong, an infectious disease expert at UCSF, is back on with us. Nice to see you, Dr. Chin Hong. What are you seeing right now at UCSF?
Well, we're seeing exactly what you illustrated in California in general. COVID never really went down. It kind of stayed at a high level, continuing to increase from that high level. We have maybe about 30 patients in the hospital with COVID. In November, we are around 10. So that's to give you some level, but not 100 like we were in January and February of 2023. Flu is just starting. The story of flu is just the beginning. So that's why what people are worried about is not just COVID, which is better than last year, and flu, which might be one of the more challenging years. It's the combination of those two that might make things very hard and dicey in the hospital.
Just to talk about flu here for a second, this could be, for some of the experts around the country, the worst flu season in more than a decade. Any specific reason for this, or is this just kind of cyclical in the medical field?
I mean, it's probably due to a bunch of different factors. I think people would have thought that it would have been a little bit better than last year, but it's very, very hard to predict exactly. The flu vaccine is a very good match to what's circulating, so that's good news. But less than, about 40% of people have gotten the flu shot. So I think we still have some ways to go in that. And again, flu is challenging because unlike COVID, it's very difficult to get that diagnosis and know that you can have access to early therapy, which is Tamiflu in the case of flu. So I think there are a bunch of challenges that I think we need to solve as a country moving forward.
Yeah, that is a good reminder for that Tamiflu. Quick question about Southern California. Also seeing a rise with people who have the flu and COVID, I think simultaneously. Is that even a thing?
Yes, it's definitely a thing. It's not very common, but there's studies showing that when you have COVID, that when you get flu on top of that, that you can get sicker, particularly in children. So I think, getting multiple things is not out of the question. And just because you got one infection around Christmas time doesn't mean you can't get another, because a lot of things are moving around.
Okay,
right now.
Always something happening, keeping you very busy, and we appreciate your insight. Dr. Peter Chin Hong from UCSF. Have a good evening.
Thanks, Raj.